We've seen a couple of things. I was using a survey prior to this and was very interested in collecting data on as many patients as possible. And it was getting pretty costly with the other survey I was using. So I really looked at Edge for two reasons. One, to see if there was a more cost-effective way to collect the data we were looking at, and two, to see if I could increase my response rates. And we actually had good response rates with our previous one compared to some people. We probably had in the low 40s, and for a survey that's not bad. But I'm multi-specialty, and sometimes my smaller specialties, I got very little feedback from those patients. And so we now get, well, 60% or greater response rate on our surveys. So our response rate is great. We live in a state where we've got some older people, and I didn't know how successful we would be at collecting email addresses. But actually, I think I probably get somewhere between 75% and 80% of my clients to give us emails, and then of those, we get about a 67% or so response rate. So that's been very effective for us. I think it's reduced my costs 40–50% over the previous survey tool that I was using. One of the other things, I guess, just besides that, that's been very helpful to me is the folks at Edge have been very responsive. I can call somebody, you know, and get the same voice who will talk to me about it, and several things have improved in that 2.5 years. We now get quarterly reports instead of just monthly reports, and that was really important to me. I use my survey results as part of my staff bonus system on a quarterly basis, so being able to get those reports quarterly has made that easier than me trying to put 3 reports together and see if I come up with the right averages.